Steve Douglas is our referee once again.
Now, gentlemen, you're both professional fighters, so I expect you to protect yourselves at all times. Touch gloves. Back to your corner, good luck.
Touch gloves, fight fair. Instructions from our referee. Round number one coming your way. We trust you're enjoying CFC. It is edition number 3, and over the course of the next couple of years, there's going to be plenty more coming your way, either live around Australia or right here on Fox Sports. It is Nicholas Pudney, Alex Shevtsov ready to go at bantamweight.
It's almost the David and Goliath match here. Look at the height that Putney has over Shevtsov. Oh, Shevtsov throwing some nice punches first up.
They are straight into it, these little boys. A bundle of energy, not big men by any stretch of the imagination. On top and in the position he desires to be is Pudney.
Shevtsov's trying to work looks like an arm lock, a rubber guard there almost. Ooh, nice slam. And he turns the corner. Oh, look of pain on his face. Looks like he's in trouble.
Look at the left arm. Oh! Oh! We have a stoppage. And we have a face of pain. The arm of Nicholas Pudney is pointing in a direction, quite simply, it was not designed to point. The slam there, it loosened the ligaments. Some great groundwork by Shevtsov, and quite simply, it's dislocated the elbow of Nicholas Pudney. So little Alex Shevtsov victorious at CFC.
Our winner, hailing from Western Australia.
Hello, Doc.
Hi, I'm Dr. Mel.
Hi, I'm Nick. I'm a UFC fighter, ranked 47th in the country.
Well, it's nice to meet you, Nick. And how can I help you today?
Had a fight on the weekend and knocked up my elbow pretty badly.
Oh no, how did that happen?
Well, from what I remember, it went like this. Oh, a nice body slam there. Oh, it looks like Nick Pudney is in quite considerable pain. Oh, look at his left elbow. It looks like he has completely dislocated it. Nick has stopped fighting. It doesn't look like he is able to bend his arm at all without causing excruciating pain, and it is showing right now. The arm of Nick Pudney is pointing away from his body in a direction it cannot normally. It appears the two bones of the forearm have completely moved way past the elbow joint and are now pushing against the back of his arm. Looks like there the initial slam seemed to put his arm into a bad position, and then when he got turned, the ligaments in his elbow must have torn, causing his forearm bones to literally be wrenched from their socket into the position they are now. There is no way Nick is going to continue.
Well, that sounds pretty serious. Do you have any x-rays I can have a look at?
As a matter of fact, I do have a couple.
Beautiful. Okay, well let's see what we've got here. This is an example of a normal x-ray of an elbow joint, otherwise known as a synovial joint. The elbow is found at the intersection of the forearm, which joins the distal end of the humerus to the proximal end of the radius and ulna. This joint is comprised of 3 distinct articular joints, which are all contained within one joint capsule. This consists of the humero-ulnar joint, which is the joint between the trochlea of the humerus and the trochlear notch of the ulna. This joint is also referred to as hinge joint, as the movement can only move along one axis. The humero-radial joint. This is the joint between the capitulum of the humerus and the head of the radius. This joint is referred to as ball and socket, as it allows the distal bone to move in a variety of axes. Lastly, the proximal radio-ulnar joint is the joint between the head of the radius and the radial notch of the ulna. During common movements, such as extension and flexion of the forearm, which is in the sagittal plane and the coronal axis of rotation, the humero-ulnar and the humero-radial joints act as a single hinge joint. The muscles that assist in flexion of the elbow are the brachialis muscle, biceps brachii, and the brachioradialis. The main flexor is the brachialis muscle, which originates from the anterior distal part of the humerus and inserts at the coronoid process and tuberosity of the ulna. The brachioradialis muscle attaches at the lateral supracondylar ridge of the humerus and inserts at the base of the styloid process of radius. Biceps brachii attaches at the coracoid process and the radial tuberosity and also assist in supination of the elbow. During pronation and supination of the forearm in the transverse plane and longitudinal axis of rotation, the proximal radio-ulnar joint allows rotation of the head of the radius. The supinator muscle assists in the movement of supination by attaching at the lateral epicondyle of the humerus and the proximal anterolateral surface of the radius. Your X-ray, however, shows a posteromedial elbow dislocation as well as a minor anteromedial facet coronoid fracture. This is evident as your ulna and radius are posteriorly displaced from the humerus. This particular type of injury is a result of falling on an outstretched hand with the shoulder in a flex and adducted position. This reflects your arm position during the fight, as your arm was locked by your opponent and slammed to the ground under an extreme amount of force. When the bones of the forearm are positioned in this way, dislocation and fracturing occurs with varus posteromedial stress. If the fractures were left untreated, the anteromedial facet of the coronoid could cause PMRI of the elbow, which is known as posteromedial varus rotary instability. Luckily, your X-rays only show a small fracture, which the body will be able to mend without the need for surgery.
Okay, so because of the seriousness of the injury, I just want to make sure there's no further damage. So I'm going to book you in for an MRI to assess any soft tissue damage that may have occurred.
All right. Thanks, Doc.
You're welcome. Good, Nick's MRI scans have come through. There we go.
On the T2 weighted frontal MRI scan, I can notice that Nick has damaged both the collateral ligaments of his elbow. He has ruptured his medial collateral ligament where you can see the black arrows are, and has also torn his lateral collateral ligament seen by the white arrows. The medial collateral ligament helps to resist valgus force and supports the ulnohumeral joint, whereas the lateral collateral ligament prevents instability and lateral flexion. I can also notice a high-grade rupture of the distal brachialis muscle, indicated by the arrowheads. The brachialis muscle is the most common muscle to be damaged and is in the anterior compartment of the arm, responsible for flexion of the elbow. As you can see, here's a diagram of the ligaments of the elbow. The lateral collateral ligament, otherwise known as the radial collateral ligament, originates at the lateral epicondyle of the humerus and inserts into the annular ligament of the radius. This is opposite to the medial collateral ligament, also known as the ulnar collateral ligament, which extends from the medial epicondyle of the humerus to the coronoid process of the olecranon of the ulna.
Hi Nick, good to see you again. How are you feeling?
A lot better, thanks.
That's good. I've just called you in today to go over your diagnosis and prognosis for your elbow injury. So from your scans, we've discovered that there is a rupturing of the ligaments in your elbow as well as a tear in your brachialis muscles. Luckily, there is only minimal bone fractures, which the body can heal without any surgery, and your nerves and blood supply have not been damaged. What we would normally see if damage to the nerves and vasculature would be
possible brachial artery damage, but this is more commonly seen in the open fracture dislocations where the skin has been penetrated. This can cause loss of blood supply to the muscles in the forearm and hand, resulting in functional implications. This injury is normally accompanied with damage to the median nerve, which is found within the cubital fossa. This would result in implications with pronating and supinating the forearm and flexing the elbow. The median nerve also innervates the pronator teres, flexor carpi, radialis, palmaris longus, and flexor digitorum muscles, compromising their function as flexors of the wrist. Possible damage to the ulnar nerve can occur, which would cause loss of coordination of the fingers and loss of innervation to the flexor carpi ulnaris muscle. Very lucky for you, as no injuries to these nerves or artery occurred.
So, Doc, when can I get back to fighting?
Okay, so my prognosis is approximately 6 to 8 weeks recovery, as well as some physical therapy to make sure you regain full movement and strength in your arm and elbow joint. In the meantime, I recommend you implicate the Rice method, therefore ensuring that you rest, ice, compress and elevate your elbow to reduce the swelling. I'll also prescribe you some painkillers to assist in the discomfort. And I wish you a quick recovery.
Thanks, Doc.